Did you know? According to WHO, more than 280 million people worldwide suffer from depression, which accounts for approximately 3.5% of the total world population. In the US, over 30% of people struggling with depression do not find relief through medications alone. But the good thing is that a breakthrough treatment is available, and that is Transcranial Magnetic Stimulation, TMS. This is not just any ordinary treatment. It is a non-invasive, pain-free, and scientifically proven method that has transformed the lives of thousands of people who were not benefiting from medications. Hello, everyone. My name is Dr. Syed Quadri, and I am a psychiatrist. I have been working in this field for the past 15 years. In today's video, we will deep dive into TMS, how it works, who can benefit from it, and why it is considered a ray of hope for depression treatment. If you or someone you know is struggling with depression, don't miss this video, because it could change your life. According to WHO 2019 data, more than 280 million people worldwide suffer from depression, which accounts for approximately 3.5% of the global population. As per the NIMH, National Institute of Mental Health Report 2020, over 21 million people in the US were affected by depression, meaning 1 in 10 individuals struggled with it. Currently, depression cases are expected to rise even further. Despite the increasing prevalence, it is crucial to understand that with the right treatment and support, depression can be effectively managed and treated. The big question? About 30% of people struggling with depression do not find relief through medications or traditional treatments. So what's the solution? An effective treatment is available that is called TMS. Let's dive in. What exactly is TMS? TMS is a non-invasive, FDA-approved, and highly advanced treatment that uses magnetic pulses to activate the brain's nerve cells. It is a game changer for those who do not respond to medications or traditional therapies. Now, many people may have questions like, is TMS painful? Does it reset brain function? TMS is a completely painless and non-invasive process that stimulates the brain without using shock therapy. And yes, it reactivates underactive brain areas, helping to restore normal function. TMS targets the dorsolateral prefrontal cortex, the region of the brain primarily responsible for mood regulation in individuals with depression. When a person experiences depression, the activity in this brain area decreases, and TMS works by reactivating it, leading to a reduction in depressive symptoms. The next question, is TMS right for everyone? Who can benefit from it? TMS can be life-changing for adults struggling with major depressive disorder, especially when medications fail to show results. But that's not all. TMS is also used to treat anxiety disorders, PTSD, OCD, and certain neurological disorders where traditional treatments prove ineffective. If you have been trapped in the cycle of depression for a long time and are searching for a way out, TMS could be a highly effective option. Why? Let's find out. According to studies, 37.5% of patients suffering from treatment-resistant depression show a positive response to TMS, and 27.1% achieve complete remission. TMS comes with minimal side effects compared to traditional antidepressants, which often cause weight gain, sexual dysfunction, or extreme fatigue. However, with TMS, these concerns are not an issue. Possible mild side effects may include scalp discomfort, headache, tingling sensation, lightheadedness. These side effects gradually decrease over time with more sessions. Another major advantage is that TMS requires no medications, and you can resume your normal activities immediately after each session. Now, let's understand the TMS treatment process. How is TMS therapy administered? TMS sessions typically last 10 to 20 minutes and are conducted entirely in an outpatient setting, meaning no hospital stay is required. According to the standard protocol, 1 session per day is required, lasting up to 30 sessions over 4 to 6 weeks. However, with your doctor's guidance, you can opt for multiple sessions per day and complete the treatment within 5 days. Now that you have a clear understanding of what TMS is, the conclusion is clear. TMS is a revolutionary treatment that offers hope to those struggling with depression. When medications and therapy fail, TMS emerges as a new ray of hope. It is a non-invasive, pain-free, and drug-free solution, scientifically proven and highly effective for treatment-resistant depression. Overall, you will get these benefits from TMS. No unwanted side effects, naturally rewires brain function, FDA-approved and clinically tested, personalized treatment with long-term results. If you or someone you know is struggling with depression, TMS could be the step towards a better and healthier life. Today you learned about TMS and why it is a breakthrough solution for depression. If you found this information helpful, like, comment, and share this video because someone out there might need it. Subscribe to ensure you don't miss such informative content. Mental health matters. Take the right step at the right time. See you in the next video. Stay healthy, stay positive.